Now, today is World Meningitis Day. This year's theme is #Defeat Meningitis. Although the viral infection has a high fatality rate, meningitis can be prevented. Statistics show 2 people in 100,000 will contract the meningitis infection. Children under 5 at the highest risk. For more on this, I'm joined by Dr. Nasiha Sufi, from the Sanofi Pasteur vaccines in South Africa. Doctor, thank you so much for joining us. It's not only World Meningitis Day, but it's also the beginning of World Immunization Week. There is a vaccination for this life-threatening brain infection. What proportion of South African children are getting it, though?
Hi, sorry, I was on mute, yes.
Sorry, Dr. Sufi, I just have to laugh because this is what we are all doing right now. This is our new reality, and I don't think any of us have ever mentioned you're on mute more than we have in the last month. So please go ahead. I was asking you about the vaccination stats. How many children in South Africa are actually being vaccinated against meningococcal meningitis?
I'm sorry, Sally, you had cut off for a minute, but I'm just going to pick up from your initial question. So yes, meningococcal disease is a vaccine-preventable infection. It is 100% preventable using vaccination. We do have a premier product in the country, which does provide broad-spectrum protection against most of the serogroups which are associated with invasive disease. In terms of your question regarding the burden of disease in the country, we need to be mindful of the fact that research capacity in South Africa, considering it is a low resource setting, is limited. Most of our research capacity is heavily invested in HIV, TB, and so forth. The latest stats published for South Africa showed an incidence rate of less than 0.2 per 100,000 people. But of course, the concentration of cases will increase in children less than 5. And the younger they are, from 5 years of age, the increase in cases.
Now, reading up a little bit about it, it seems it's spread in a similar way to a number of viruses and spread in a similar way to COVID-19 from getting too close to people. Tell me how it is spread.
So meningococcal disease is spread via respiratory droplets, so by coughing, sneezing. It can also be spread by saliva, so by kissing or sharing the same eating utensils.
Okay, it's not that common in South Africa, as you say, but the younger children are more vulnerable, and it really is a very dangerous infection. It's also more common in the months we're going into now, the winter months, from May to October, I believe.
Absolutely. So the epidemiological trend in South Africa shows an increase in cases during the winter and spring months.
So we don't know exactly how many parents are immunizing their children against meningitis in South Africa. I'm wondering if that's, obviously the data is an issue, but if you look globally, there has been such a strong anti-vaccination lobby that we're seeing the recurrence of diseases that were actually wiped out. Is that a factor in South Africa? Are parents worried about vaccines and choosing not to vaccinate their children, or is it more an issue of not enough public health access?
That is a brilliant question, and thank you for postulating the question. So it's a combination of two. Firstly, South Africa is a low resource setting and there are funding constraints. Unfortunately, the government does not subsidize the meningococcal vaccine, and so access certainly is an issue in South Africa. However, with regards to the anti-vaccination campaigns, whilst these campaigns are more pronounced in first world countries, we are seeing concerningly a growing trend in South Africa. Now, to tie that up with the COVID-19 pandemic, if I may, currently our healthcare resources are overburdened with the pandemic. Now, imagine an outbreak of a perfectly vaccine-preventable disease.
And also, I'm wondering, this concern by the anti-vaxxers, you speak to any scientist, anyone who really knows the research, and they say that while there are vaccine injuries, they are by far and away an extreme minority. But I'm wondering if that lobby group has calmed and quietened down now that we're faced with a pandemic for which there is no cure, there's very little treatment, and we can't prevent it because we have no vaccine.
Absolutely. It's a humbling moment for the human species. Every talk that I give cross-nationally, I always begin with this statement. Human beings are arrogant species. We think we rule the earth, but actually we live at the mercy of microorganisms. We live at the mercy of viruses and bacteria. Each and every year, we die by the millions as a result of these viral and bacterial infections. And very often, these infections are difficult to diagnose because clinical symptoms are ambiguous and treatment is not always effective. And so really, the only tool we have to protect ourselves as a species really is immunization.
Yeah, absolutely. Thank you so much. That is Dr. Nasiha Sufi. She's the medical head of Sanofi Pasteur Vaccines here in South Africa. Today is World Meningitis Day.